So for those of you that are newcomers to Surgeons for Little Lives, our core focus from the outset was the clinical care of patients requiring surgical procedures in the state healthcare sector. And reflecting on the last 9 years, it's been extremely satisfying to see that clinical focus and care of those patients remains key and at the forefront of what we do.
Lunga is my young man. He was born with hypospadias. He is good. He's functioning very well. We came here actually before this building was renovated. After his first operation, he had a fistula, which they corrected, and he's fine. He's good. Everything is good. To know that you are able to get assisted is like, wow.
Renovating the burns unit was one of our core listed projects when we launched 9 years ago.
It's almost been exactly a year since we did this video the last time. And since then, the burns unit has changed quite dramatically.
Those 7 beds was not enough at all. It's not easy to tell somebody from another hospital where you know that there is no accessories, equipment and that you don't have a bed. This 4 bed exists, we're gonna make a difference for us so that we can take 11 ICU patients.
And we moved patients into the unit on the 31st of July.
So this is a very, very beautiful one. You can see that this is meant for kids and we appreciate a lot for this.
And what we have here, in fact, is even better than many centers that I've visited overseas.
When they told me that my son changed into blue color, his heart stopped after going into the ventilator, they told me that, you know what, your son he is not coping. The baby managed to come out on the trachea, then I was crying each and every day. They were encouraging us, they give us blankets, they give us clothes, donations for clothes, soup, everything. Like, I just want to say thank you to them.
By training a single pediatric surgeon, you can have a vast impact on tens of thousands of patients through that surgeon in their clinical practice.
Surgeons for Their Little Lives, the opportunity that they give me has enabled me to acquire knowledge that will benefit when I go back home. I'll have an impact on the patients, especially the children who need our pediatric surgical services. To sum up everything, I just want to say thank you to Surgeons for Their Little Lives. Thank you so much.
One of the things that I'm looking forward to really implement is neonatal and pediatric ICU care in Malawi, which especially Kamusenti Hospital, which we usually don't have at the moment. Many thanks to Surgeons for Little Lives. I really appreciate for your help and looking forward to see you again.
Over the last 3 years, we've employed a director of research, Professor Scribanti.
Now that I've come to the end of my training and I've qualified as a pediatric surgeon, in order to do that you need a master's project. So I had to do an MMed. And as a novice researcher, this was a great struggle for me, where Prof. Scribante was instrumental in ensuring that I ended up with a research project that was of good quality and now is published in an international journal.
Joanne is currently helping me and supervising me with my research, and she's actually being very invaluable to me because she's taking me through the nitty-gritties of research that I didn't know, but she's a person that I didn't think I needed, but I really need in my life.
So Surgeons for Little Lives has implemented a research award that's of monetary value.
The award offered me the flexibility to explore pediatric surgery in more disadvantaged regions of our country. I had always envisioned practicing my specialty in less resourced and less cosmopolitan areas of the country, almost like another round of community service, but as a specialist. I also managed to explore academic research in that context.
Approximately 2 years ago, we launched into a new electronic data collection project, which is called OneBeat.
It's like a digital nervous system for the hospital that interconnects all the information amongst the doctors so that they can collaborate in the best way possible to give the best patient healthcare possible. We've had very successful implementation initially within pediatric surgery at Barra, and off the back of that success, there was an impetus to expand it to general pediatrics and neonates at Barra. Those are much bigger departments and far more complex in nature. The success of OneBeat has really been facilitated through an incredible partnership between Business Science Corporation and Surgeons for Little Lives.
Our son Oliver was born at 31 weeks, weighing 1.2 kilograms. When he was born, he wasn't breathing. Oliver was born with esophageal atresia. After this operation, it was a great success, but sadly, it was picked up that Oliver also had a twisted gut. I think it's called a duodenal atresia. This was then had to be another 4-hour operation on this 1.2 kilogram baby. We are truly grateful to Jerome and his team and what these surgeons can do for these little babies that are born with no chance in life but are able to become these miracle babies.
Surgeons for Little Lives has had such a huge impact on my career growth, as well as the experience that I've obtained over the years. As an admin supervisor who liaises with the outside community on a daily, I really love to see people actually committing to contributing to our charity. But more than that, what gives me pleasure is to see people that come back again and again. I mean, that simply means we are doing something right.
One of the most impactful projects that we started with right at the beginning of the charity was providing patients with an admission and or a discharge pack.
You know, when you get to give a patient a discharge pack and they get to go home and they are so excited about getting that small toy or a piece of clothing or whatever is in the pack, that is just amazing. I mean, kids are just fascinated by small things. So when you see a patient leaves and they're happy, I just love that. And I'd like to say thank you to everyone who continues to contribute towards this project.
So at Baragwanath Hospital, we face a high burden of preventable disease. The most common preventable disease that we treat are burns. Burns are extremely debilitating, they're extremely serious, they're extremely expensive to manage, and they have a devastating impact on the families and the patients, and actually on the healthcare service. So what we did was formulate a prevention-based burns program.
I'm looking at the burns statistics, especially hot water pains in children. There is an improvement.
We have divided our health promotion into 4. The first week we go to the clinics and educate the community. The second week we go to the hospitals. And the third week we attend to the lodger mothers at Baragwanath Hospital and go to maternity. And the fourth week it's the mothers again and the support of the nurses who are doing burns.
I do health promotion on community radios around here.
And I'm sure that on a daily basis, through the radio shows that we have a partnership with, through the different organizations that we have a partnership with, we access hundreds to thousands of people in the hopes that by giving them this message, they're going to change their behavior and result in a decrease in the number of burns that we see.
We see around 50 patients every Wednesday with colorectal conditions. It's a wonderful clinic. It's full of beautiful patients, and they usually become patients for life. So we never get rid of them, and we follow them up for the rest of their lives. So we even have adults that still come to us in clinic.
I was born with Hirschsprung's disease at the age of 3 months. I was diagnosed at Charlotte Maxeka Hospital. So I've been an ostomate for the past 26 years. And it has been quite a journey. I volunteer at Chris Hani Baragwana. It has been close to a year. I help to run the clinics, and I also try to interact with some of the patients that has stomas. I guess that this is what gets me out of the bed in the morning, not just because of my disability, but because of the work that Surgeons for Little Lives does for the community out there.
We've had such a good relationship with the upper echelons of the university, shall I say, and specifically the current Vice-Chancellor, Zeblon Vilakazi.
Surgeons for Little Lives is an incredible and very important intervention in our health sector, in managing to fill in a gap in how we can manage the burden of health, disease, and also injuries and trauma, in particular in the area that sometimes can be neglected, that of child trauma. I'd like to take this opportunity to once again encourage everybody who's present tonight to do whatever they can to support this wonderful and marvelous initiative. It doesn't only serve the people of Soweto through the Chris Baragwanath Hospital Complex, not only Gauteng, but this region, including some of the neighboring countries here.
We've been very fortunate over the last 9 years to attract significant funding, and for that I can only thank everybody in this room. One of the goals moving forward, outside of donations to named projects, as you see on your tables, is to further build our endowment. And as individuals and the corporates that you represent and go back to, I would ask all of you just to think further about contributing to Surgeons for Little Lives for the sustainability of our futures. Thank you.
After this 4 months, I still say thank you to the Surgeons for Life for being there.
When I was a manager, something was done under my management. So thank you very much to make my dream come true.
Our son, who is now 6 foot and bowling, playing cricket, mainstreaming, and has turned into a perfect teenager.
I don't think there is the right way to say how grateful I am, we are, because I think when he's a little bit older, he will understand, you know.
I would like to say thank you to Surgeons for Little Lives for not only the opportunity they have given me, but also opening doors for other people. Yes.